Hi, good afternoon. My name is Danielle Haley. I'm an assistant professor in the Department of Community Health Sciences in the School of Public Health. And my research, kind of shifting away from individuals, really focuses on the larger social determinants of health, with a focus on how features of the social and built environment, including policies, create disparities in health and healthcare utilization among people with or at increased risk for HIV. I use multi-level geospatial and qualitative methods to explore these topics. Next slide. Policies have the potential to change local context for broad swaths of the population. Because laws and policies are shaped by elected officials, voting plays a critical role in determining the allocation of social and structural resources to communities. Racialized policing and criminalization of substance use in the US has resulted in the systematic exclusion of Black and brown bodies from the voting process, as depicted in this cartogram where we see the bloated states in the darker red. Our own work has found that women living in areas where a larger proportion of the population was excluded from voting were at greater risk of testing positive for an STI. Next slide. As a case in point, Medicaid expansion had the potential to increase access to healthcare by decreasing the number of low-income people who lacked health insurance. However, we know that not all states opted to expand Medicaid as depicted as in gray on the map. These decisions fell largely along party lines. Next slide. When we consider the impact of a policy on health, we need to also consider local context and infrastructure. As you are likely well aware, the US is experiencing a surge in opioid overdose. Although 3 FDA-approved medications for opioid use disorder exist, these treatments are underutilized. As shown in black in this map, there are large portions of the country with little or no access to facilities that offer both treatment for opioid use disorder and accept Medicaid. We have found that geographic access to substance use treatment in the US varies by the treatment type and community income, race, ethnicity, and urbanicity. Next slide. There's a substantial debate regarding the health impacts of cannabis legalization on adults. A challenge to date is that there's substantial heterogeneity in how states have approached the legalization of cannabis, but the majority of studies examine the presence or absence of the law. Geographic access has been identified as an important determinant of use, but we know that access to retailers varies across states. Our work has found that geographic access to cannabis retailers is also socially determined, with areas that have higher poverty rates tending to have more concentrated retailers. We're currently examining relationships between geographic access to cannabis retailers and cannabis and alcohol use among women with and without HIV. Next slide. Policies may produce both intended and unintended downstream effects, and these impacts may in part depend on individual characteristics. As a case in point, changes in housing policy in Atlanta resulted in the mass migration of people living in public housing. Although people generally moved to neighborhoods with less poverty and reported improvements in sexual and mental health, they were also removed from centralized resources like healthcare and transportation. People with substance use disorder tended not to experience as many benefits as people who did not use drugs. This is likely because people with problematic substance use had trouble securing and keeping housing on the private rental market. These findings reinforce the need to understand whether and how policies impact different groups and respond accordingly. And although we've covered a lot of ground in 4 minutes, I really encourage all of us to think not only about individual determinants, but also thinking about how larger social and structural features of the environment and of policy influence health, and think about how we can integrate that into our work. Thank you.